I'm the lead accreditation officer at the British Acupuncture Accreditation Board. And I'm delighted to say that Vivien Shaw, Dr. Vivien Shaw, is our new accreditation officer and also the author of this really, really exciting research that she's been doing for her PhD. I'm sure she's going to fill in all the details, but Vivien is a BAcC member. She's a really experienced acupuncturist. She's also an experienced anatomist and teacher of anatomy. And so I'm going to hand over to her to take us into the realms of history. Thank you.
Thank you, Harriet. And thank you all for coming, and I'm very, very pleased to be here. Very grateful to BAcC for inviting me. And so I'm going to talk about meridians. This talk comes with a slight sort of public health warning. I'm an anatomist. Further on, there are pictures of cadaveric material. If you find that difficult when we get there, you're welcome to leave. Most people don't, but if you do, then there is absolutely no problem. I won't be upset or offended or anything if you just go, you know what, that's too much. So I wanted to talk about the word meridians to start with, and we're going to do this in two halves. I'm hoping that by the end of this session, I will manage to persuade you that what was happening in Han Dynasty China when acupuncture was created was science, medical science, in its sort of ordinary form. And so we're going to look first of all at the theory, and then we're going to look at sort of empirical evidence in the second part. So the word meridian was coined by Georges Soulier de Mauron. He was born in Paris, and to put this in sort of historical context, 1879, Queen Victoria was still on the throne in England, and there was the Qing dynasty in China, so there was an emperor in China and Victorian England here. And he was taught to read and write Chinese and to speak Mandarin by a Jesuit when he was a child. So as an adult, he kind of went into his working life with fluent Chinese. And so he was snapped up by BAcC. He went off to China to work, and after about a year, and that was in 1901, so it was actually just when Victoria died, and so we moved into the Edwardian era here. Still got Qing dynasty in China, and he ended up working for the French diplomatic service. And whilst he was in Peking, he saw a cholera epidemic, and he saw acupuncture being used to treat cholera victims, and was really, really impressed that they got better. You know, and at the point where he was watching this, two of his servants had just died of cholera. So you know, this was a really big deal for him. He became very interested in acupuncture, and partly because of his interest, because he was fluent in Chinese, because he was living there, the Chinese, even though normally they would not share their medicine or the information about the medicine, they trained him. So he worked with some of the best doctors at the time, and he lived in China in total for like 20 years. And he was recalled in 1917, so just before the end of the First World War. He came back, and he was an acknowledged Chinese master in China at the time. So the importance of about this is, and then whilst in France, when he came back, he wrote these tomes. So he wrote L'Acupuncture Chinoise, and it was the first training book, where you could pick it up. It was at the time the equivalent of what Giovanni's books are now, obviously written in French, although it is now also available in translation. And so he brought back acupuncture the way it was before the Cultural Revolution. And he translated Jing, meridians, as meridian. And so at the moment, you know, people call it pathway, they call it conduit, they call it channel, whatever. But there is no reason at all, none at all, to believe that Georges Soulier de Mauron didn't know what the word meant, or that he wasn't capable of translating accurately. And so if you accept that this word does mean meridian, or that he translated accurately, then it sort of poses the question of like, well, what was a meridian in Han Dynasty China? So Zhang Hen was sort of in the beginning of the Han era, and he was a polymath. And one of the things that he did for the government, so he was one of the sort of commoners that went to the Imperial College or the Imperial University, which was set up in order to create a class of bureaucrats. And there was a lot of significance for that. And part of it was that if you have bureaucrats that are brought not from the noble families, then it means that the noble families sort of lose their grip on governance, and you end up with people whose their first allegiance is to the government. It's not to their own particular family in their own particular house. It's a way of creating harmony within the government. Anyway, so Zhang Hen was one of these people. He was very, very smart, and he rose through the ranks to become the director of the Imperial Bureau of Astronomy and Calendrics. There we go. And the point of that is that he understood astronomy. His job was to set the calendar. And one of the things that he did was he created this grid form for maps. So if you look up what does Jing mean on I use Yellow Bridge online translation, one of the translations is it's the north-south line in a field. And that's what he created. It was he created these maps, and they weren't to do with world exploration. They were to do with governance. They were to do with making maps of areas of land so that you could manage the agriculture, so you could manage the water, so you could decide where the boundaries were. And so all of these things all of these concepts are part of this word meridian, which, and if you think about it, you have one horizontal meridian and all the rest are north-south. So, so that's just, the history of that particular word. But the first medical text that mentioned what we call meridians didn't call them that. So the Ma Wang medical texts, they were found, they were exhumed from a tomb in sort of the early 1970s. The tomb was closed in 168 BC. And the texts that they found, they describe pathways through the body, and they call them Mai. So Mai just means vein. I spent a lot of time looking at the texts, and I'm an anatomist. I had access to cadavers, so I was going, what if these texts are describing body? And what I found was that they described the body, but they described the blood vessels almost exclusively, with the exception of the big meridian sort of Tai Yang that comes up the back. And they describe the body in terms of divisions. So they don't, So you've got 6 divisions of the body. And the longest and the biggest meridians that are described in Ma Wang Dui are the 3 Yang. So you have, of the foot. So you have Tai Yang, basically covers the whole of the back. Yang Ming, or Shining Yang, covers the whole of the front. And Lesser Yang, Xiao Yang, covers up the side. And they all come up the back and over the top of the head, up the side, over the side of the head, up the front of the face. So those 3 Yang meridians, between them, they cover the whole body, but they're also, of the texts that are there, they're the ones that are longest, they're most explicit, and there's more detail on them. And one of the things that happens in this is, like, the texts themselves are quite terse. So you get what I call country directions. So, if somebody's telling you, I mean, you don't get this so much because you have a phone and you look on your phone, but back in the day where people would give you directions, they go, so you come over the bridge and then you turn right by the Anglesey Arms and then you keep on going and then you come to the Big Cedar. So you take a left at the Big Cedar and then you're stopping just by the bridge pub on the other bridge, and there is no indication in between in those directions how long. So sometimes you're like there and you're driving and it's like 15 minutes later and you're like, have I missed it? Should I go back? Should I go look for it? I don't know. And it's just because when you're giving directions, you give landmarks. You give the big landmarks that stick out in your mind. And by and large, I don't know if everybody else gets this, but when you're driving home, you miss most of the journey. You're thinking about your dinner and what you're going to do and all that. And then, and then you go, oh, I need to turn left now. And so when you read the texts, they're kind of like that. So I'm not going to go through every one because, there's a paper that does that if you're interested. But I do want to talk about the yang meridians of the arm in that context. So the yang meridians of the arm are coming up this surface, and you have sort of starting point from 3 different fingers. So anyway, but what they're doing is they're following the cephalic vein, which is the vein that goes sort of roughly from here. And you can't really see it very well on me, but sometimes you get people that are quite thin or quite muscular, and you can see it really, really clearly. And it kind of comes up this way, and then it runs and it stays on the surface of your body, and then it runs up and it runs sort of through your shoulder, and then it comes over the clavicle, and then it drains into the main veins that are here. You have another one that again is usually very visible that comes sort of on the other side. So this is going to be Yang Ming. And then on the other side, you've got Xiao Yang, and then in the middle, you've got Xiao Yang, and on the outside you've got Tai Yang. But what they all do, from the point where you get to the elbow, is they all become part of the same vein. So if what you're looking for if you're not looking at a body, if you're looking in an anatomy book and you're going, but there aren't 3 different things that all run from here up to here, it's because at this point they all become part of this one cephalic vein. And then from here, so it goes from here, it goes into the main bloodstream, into the heart, but it also goes up to the neck. And then so what you have is you have 3 branches. You have a branch, so they're coming up the neck, and then you've got one that goes over the face to the lips and to the teeth. You've got another one that comes up behind the ear, and then you've got another one that goes back over the shoulder. And so the 3 yang ones in the Ma Wang Dui text are tooth, ear, and shoulder. So this was what I found, and there's this big sort of gap between Ma Wang Dui and the Yellow Emperor's Classic, and I know there's sort of quite a lot of people in this room that know these texts really quite well, but you have the Suwen, so you've got 2 books that make up the Yellow Emperor's Classic, and they roughly correlate with different sections of the Han era. So the Suwen is earlier, and that's the first book, so the basic questions. The second book is the Spiritual Pivot, the Lingshu. And in the Han era, you had the Western Han, who were sort of roughly up until the year 0. Then you had this 17-year period where a guy called Wang Mang became the emperor, from 6 AD to 23 AD. And then you have the Eastern Han. And so these 2 books, they reflect different parts of history. And in that section in the middle, in Wang Meng's dynasty, when you look in the record of the Han dynasty, you find this text. It's quite a famous text. I left in the bit, I'm going to let you just read it. So if you just take a couple of minutes, just read it, it's quicker. Okay, so is everybody, yeah? So to kill somebody and then dissect them was a huge punishment. Meant that the ghost couldn't rest. And so in this case, it was something that was happening to somebody who was a traitor, essentially. It wasn't a common punishment. And within the Han era, that in the previous eras, they'd been very much there were mutilation punishments, and as the Han era progressed, it's like the Confucian ideals were that mutilation wasn't really necessary. That there were other ways to punish people, and so this was really quite extreme. But the important bit for me is this bit here, is that they used a bamboo strip to trace the courses of the circulation vessels to learn where they began and ended, and that the emperor said that this knowledge could be used to cure illness. This translation was Homer Dubs. And so the point here is that what they're looking at is the blood vessels. Again, you've got, these are blood vessels. So that early understanding of where the blood vessels ran, that was a necessary part of medicine, was to understand where does the blood go. In this section in between the two Han eras, you've got more dissection happening for the same reason. It's to understand where the blood goes. And, blood, it's really intuitive. It's like, that if you lose blood, you become weak. If you lose a lot of blood, you die. But at the same time, there's this conundrum, because if you have a cadaver, so somebody has died, and then you open them up, what you find is blood. So clearly it's not sufficient. There must be something else. There must be some other animatory force. But you can see where the blood goes. And when you're looking in a cadaver, you have what's called a neurovascular bundle. So you have a vein and an artery and a nerve, and they travel together. And so if you're just looking at this and nobody's there to tell you you're looking at a neurovascular bundle, you don't know anything about nerves. You know about blood, because that if you lose your blood, you die eventually. But so you're looking at something, so you're looking at a vessel that's got blood in it. Your arteries tend to stay open. They've got a sort of muscular outside, so they maintain their hole, they maintain their lumen. So you've got a thing with blood, you've got another one that's open and that's empty. And then you've got another one that's sort of dense. And the artery and the nerve, the dense one and the empty one, the outsides of them have a similar sort of quality. They're kind of a bit fatty and chewy almost. Anyway, but so understanding this, if you've got like a rubbery thing, no, I don't go and chew people. Bad choice of word. Yeah. Rubbery. Let's go with rubbery. Yeah. I'm sorry. Yeah. I'm sorry. Yeah. Okay. But so the point of all of them doing dissection was because by understanding where the blood vessels go, you're going to understand illness. And so there's some big major differences between the descriptions that you find in Mo Wangdui and the descriptions that you find in the Huangdi Neijing. And I'm just going to talk about a few of them. This isn't all of them, there are more. But so the first one is that you've got a heart protector, or in fact, this second word actually means host, so a heart host. So you've got the pericardium channel coming in. This is detail. You got a huge amount of detail. Where in the Ma Wangdui you had these like really terse texts, and there's 3 manuscripts, and you kind of have to put them all together in order to get a full description. Here you've got these like blow by blow descriptions of it goes here and it goes here and it goes here and it goes here and it goes here. You have a concept of circulation like a ball of string. So things go round and round and round and round, and you have with Ma Wangdui, it's like the directionality isn't there. It just goes as a line, whereas here you have flow from meridian to meridian. And obviously it corresponds to particular times of day. You have organs. So you have your meridians are related to a particular organ, and a part of their pathway is also the internal pathway where it connects into that organ. And again, coming back to the country directions, most of them go down the middle. They kind of come in and then they all follow the same pathway down the middle. So that part is still true. And then this last one. So this is, I'm sure you're all familiar, 9 needles. But you had, actually, if you're reading in the Suen, you've got pointed stones and fine needles. And they always come together, those phrases, or nearly always. And pointed stones were used for bloodletting, and the fine needles were used for the acupuncture. And so when I first read that, I was like, brilliant. I know where this all came from. They used bloodletting, and the bloodletting just turned into acupuncture. How easy can that be? And then you look at the Malwen Dway and there is no mention of bloodletting. It's like, okay. The pointed stones are in the Malwen Dway, but they're using them for lancing. They're using them for pus and for some inguinal surgery. So, somehow in that interim period, you went from, we just need to know where the blood goes, because that's really, really important, to if we know where the blood goes, we can control it, we can use it for healing. And we can use bloodletting and fine needles and moxa still. Moxa is still very much part of this to do that. And that's all happening in the meridians. So the other meridians that are also in the Suen is these 4, Rendu, Chong, and Dai. I'm kind of assuming everybody knows this and I don't need to explain. So when you look at, so I've been going through the Suen. I have a spreadsheet. I'm a geek, I'm sorry. And I've been pulling out every reference to a point that I can find. Because I started off wanting to know how many points are there in the Suen and what they called. And then it just became interesting. And what I found is that most of the points and most of the descriptions are actually the Yang meridians and Ren and Du. So the ones that kind of cover the surface of the body. And when they're talking about points, with a very few exceptions, the points that they talk about are the transportation points in the arms to the elbows and the BAcC points. And the BAcC points that they talk about are the 5 yin ones. And it's not, so there's 81 chapters in Suen. It's not until you get to something like chapter 66 that they start talking about the outside BAcC points. And when they do, it's in relation to treating the lumbar. So it's not all of them. It's not like you've got a whole line. And that's also the point where you get the other ones coming in as well. So you have this sort of development of an idea where you start off, you're talking about the broad surfaces of the body in the midline. And then you're starting to talk about points, and they don't necessarily give them names. They just go, there's this amount of them. Most of the time, if you're looking at names, it's quite helpful. Wang Bing, who collated the Suen several hundred years later, in his footnotes, he actually writes which ones they are. But that's the only way you know. Yeah, it's in the commentary. So, they're going, there is this broad descriptions and there are these points, but we're not going to tell you what they are, what their names are, or where they are. Okay. So that's kind of what it's looking like in the Suen. And then you've got, I'm going to just talk about what Chong meridian is. So if you do the same thing that has been my way of doing this research, is I looked at the body and I took the description of the Chong meridian. And the Chong meridian is a reservoir of blood. And when you open up a body and you look at it, the vena cava is the only one left-sided vessel, is the only left-sided thing. in terms of blood supply, and the veins are the things that are full of blood. And so you've got this big vessel that is sort of goes all the way through the body, all the way through the leg, and then you've got this big sort of reservoir that sits just in front of the spine on the right hand side, and then it goes out, and you've got blood vessels that are going down the arms and then up to the face. So the other thing that is in that is then if you take, there's a whole series of points that are called chong. So I'm not talking about the kidney ones that are on the front, but the ones where their name is chong. And they're here. So they're up on the top of the head at the terminal end of the arteries here. They're at the ends of the fingers here. They're on the foot. And then there's one that's in here. And so these are, if you look at them, they're all places where the blood supply ends, or where you've got a pulse. So this one here on the instep, you've got a pulse point there. And so the conclusion that I drew from putting those pieces of information together was that what you're talking about when you're looking at chong is this big blood reservoir that you only know about if you look at it through dissection. So I kind of followed that particular idea again with different points. So I made another spreadsheet. And what I did is I actually took Nigel Wiseman's book, Grasping the Wind, and I went through and I pulled out every single instance I could find of these names. And I was just looking for data sets. I didn't have any preconceived ideas about what I was going to find or anything. I was just going, which characters recur in point names? So these were the ones that I found. So I picked out Tian and Sha. And so they're quite straightforward. So Tian they're all above the umbilicus, and Sha, they're pretty much all below. I think there's one that's on your hand, but if you actually have your hand by the side, it's below. And you know, Tian Sha, if you put it together, it means the world. It's kind of nice, but I don't know if that's intentional or not. But so in anatomical language, above is superior, below is inferior. So I'm looking at this and I'm going, okay, I'm an anatomist. I'm interrogating ancient anatomy. Let's go with they think in a similar way. You know, let's go with they are trying to describe the body and identify things in a way that means that you pass information on. So that's the function of the anatomist. The anatomist is the person who does that work of looking at the body. And it really isn't everybody's bag. It really isn't. But, you know, for the people that do it, it's absolutely fascinating. It's just like totally engaging. But then the job is to find a way to communicate what you found and what you've seen with everybody else, because, you know, the information that you gain is relevant to everybody, because everybody's got a body. So the next one that I found was Liao. So over the sacrum, the points of Liao. So you've got Framina. And some of them are more like big dips, so in the shoulder. And then the next one I picked was Shi, which is ravine. And so actually in the Su Wen, they talk about ravine and valleys. So valleys like Hegu. Gu is a valley. And so a valley is a sort of shallow meeting of flesh, and the ravine is a deep one. And then I picked out Fei and Wei just because they only had 2 instances. So I was just like, okay, does it still work if you've got a small number of points that have that name? And so with the Fei, they actually describe matching points in the back of your arm and on the side of your leg. So if homology is when you have the palm of your hand is homologous with the sole of your foot. Dorsum of your hand is homologous with the dorsum of your foot. Yeah? So these are homologous points. And they are points where you have a little teeny tiny nerve that goes flying off on its own. It leaves its neurovascular bundle and it's just a little thing on its own. And there are only two of way, and they're both in the back of the knee. So you've got one that's in the center and then one that's further out. Okay. So this was, I was sort of starting to put together this picture of, let's just go with dissection as a given. And then what do you find? What do you see? And so you have this big reservoir of blood. Blood is the key thing that you are interested in, that you're looking for, that you want to understand, and in particular that you want to be able to describe. And then you want to be able to share information. So these were the main kind of takeaway points that I have. And when you look, so I was sort of talking about when you first found the word meridian, that it was contextualized. It was, within the Han era, this ability to draw graphs and have meridians on them and map was useful new information. It was a useful new technique that had come about. And one of the other things that was super useful was that the Han dynasty really developed was being able to use irrigation and canals. So they had this really deep understanding of how you engineer flow of water, how you control the flow of water. And so, the idea that is coming through for me is that at the point where you're then using bloodletting, which was new, you're doing that in order to reduce excess. And then you're using moxa to tonify, to strengthen. So if you heat water, it bubbles. And then if you've got your needles, what you can do is you can control flow, but in a fine way, in a more sophisticated way. Relevant to that also is, again, coming back to the broader context, steel, the ability to make steel out of iron was a Han dynasty development. And it's dependent, the ability to refine iron ore and create steel is dependent on how much air you can put, how hot you can get it, which in turn is dependent on how much air you can put in. And so there was another member of the government who figured out a way to use a bellows in a way that meant that you got a continuous stream of air, and then he tied that to a water wheel. So you could produce progressively more and more and more air, which would force itself into the forge, make it hotter, and mean that you could then create steel. So again, huge, something to be really, really proud of. And so then if you're making your needles out of this new technology, you're at the forefront of science. And you're using it for medicine in the same way that we have MRI scanners and CTUs or whatever. So this is the definition of science that I quite like. So science is defined as the observation, identification, description, experimental investigation, and theoretical explanation of natural phenomena. So far we've looked at observation, so you look at the body. Identification, you give it names. You give things names that are meaningful. You describe it. So you leave your texts where you describe where things are. The next bit that we're going to do together is experimental investigation. So if you look at the pyramid, at the bottom of the first thing on the pyramid is expert opinion. I'm in a room full of experts, so I'm going to be asking you in a minute to give your opinions. And then a theoretical explanation of natural phenomena. So, people's experience is twofold if you're an expert. One is what you've learned in clinic, and the other is what you've experienced yourself. So, I would like you to form small groups, if you can, just sort of turn around, talk to the people in front of you, behind you, maybe move a bit if you need to, and just discuss what you know about these points, what they feel like, what they do, what your experience is of using them and having them done. Yeah.
Can I just have a very quick question before I lose it? You mentioned that in the Mahanga you thought they were the veins.
Yes.
We talked about veins, but then arteries as well. Was there a reason that you thought it was just veins as opposed to both veins and arteries, and then into the Su Wen where they talk about veins and arteries?
Yeah. So veins are when you're dead, particularly if you die because you've been executed, then the veins have blood in them and the arteries are empty. So so you were talking about they were killing criminals, or they were using criminals that had been executed, and the Greeks, the ancient Greeks, did the same thing, and they actually developed a whole theory of pneuma that flowed through these empty arteries. So it's like when you die in a stressful situation, as opposed to you just die in your bed, all of the blood is being pushed through your arteries, so your arteries are empty and your veins are full. So that's why. But if you don't know about that, all you know is you open the body and blood is in these places.
So you think these yang channels we described, obviously the veins, but what about the radial artery, which is obviously pretty close to the lung?
Yeah.
I'm just curious what you think. Is it a bit of both? Is there an overlap? Is it exclusively one or the other?
Okay. So I think, if you come back to that thing of like, most of the time nerves, arteries and veins travel together. So I think that they still went, something's happening with this, and we don't quite know what, but it's obviously significant. So yeah, because your radial and ulnar arteries are empty at that point. And they never found, I don't think, that there's a median nerve that goes here. That came later. Yeah. Okay, yeah, and if anybody else is, yeah, carry on. Okay. Okay. Has everybody had a chance to discuss at least some of them? Yeah? You good? Okay. So I was going to do this on the slide, but actually since there's a flip chart here, I was just going to write it on the flip chart. So BAcC points. Tell me what you found. Tell me what you discussed.
We talked about in 5 elements doing pain drains.
Can you talk a bit more about what that is?
So using typically when made on the first treatment to clear aggressive energy. So if the need is being you retain them for that process for any tumour, so you get coming down and needing to kind of dissipate. There is some long half an hour around about that sort of time.
Okay. More?
We were saying that we mostly use them to balance and slowly down, although you can use them to reduce extent. We don't find in practice use them for these other purposes. And we think that might be partly because of using strong
So Zhang and Fu or just Zhang? Yeah, that's true. Yeah. Fair. Yeah. Yeah.
And then that anatomical nerve link, you have got the nerve something out of the spine which directly innervate the organ.
I'd probably dispute that one, but yeah, okay. Yeah.
So I'd like to ask you that.
Yeah.
Do they innovate from those points to those organs? What's the nerve supply to the organs?
So the nerve supply that runs along in between the ribs supplies some of the back muscles and the sort of skin. The nerve supply, the only nerve supply that goes directly to the organs is the parasympathetic, and that's with the vagus nerve that goes down through the middle. So what you've got coming in and out of the spine isn't going to the organs, it's going to the periphery. And it's doing all of this. And, oh, I feel it. Yeah.
But you are at the level of the organs.
Okay, I'm going to come to that. Has anybody got anything more on this one that they would like to, that your group found that you'd like to add? No? Okay. So now I'm going to do my job. Okay, so I've had to divide this in two because the Chong meridian is quite long. So you've got the thorax here with the heart, and then this is abdominal. And this little bit of vena cava here, going up into the heart, is that little bit of vena cava there. Okay, so if you think your diaphragm is here, the heart is sitting here, and the liver's here, and they're really, really close together. They've just got the diaphragm between them, so it's literally this big. That little chunk of vena cava. Can I borrow somebody? Is somebody prepared to just sort of, yeah, would you come up? It's much easier. It's all right. No. So could you stand sideways on? Lovely. Yeah. Actually, can you stand that way? Great. Okay. So you all know how to count vertebrae. I don't know that for now. Okay. So I'm going 1, 2, 3. Yeah. So here's long shot. So if you go across, imagine, then that puts you on the sternum. And if you're right to stay there. Yeah. Great. So if you just feel, oh, I forgot about the mic. If you feel down your own sternum, there's a point where you come to the joint that's between the manubrium and the sternum. So you're above that. And you are, let's just find that again. 1, 2, 3. And you are, sorry, if I can just look, you're just below the clavicle. Yeah? So on this picture, you are over this vein that goes crosswise. Yeah? Okay, so the next one, heart, is 5. So if I do the same thing, actually I don't need to do the same thing because where the manubriosternal joint is, otherwise known as the angle of Louis, a little bit down, so that's at L45. So that is going to be behind the heart. And so you can see here on this picture of the heart, so you've got, what you can see from the front is you've got the right ventricle, left ventricle, you've got the right atrium, and the left atrium sits at the back, and it sits at that level. It's quite big, but so you're going, first of all, here, over what is the brachiocephalic vein. I don't know another name for it, so if it's not familiar, sorry. And then you're going over where the blood is coming from the lungs into the heart and going out, well, it's coming back in. So again, this is going to be somewhere that potentially has a lot of blood in it. Then at T8, actually, I'm good, thank you. Okay. That's really helpful for the bit at the top. So T8 is that there, is that little chunk there. So one of the things that using MRI, sorry, is that little chunk of, on the right hand side, so it's here and here, yeah? So it's over that little chunk of vein. So when you're doing MRI, you go and slice it. So one of the things that Western medicine is really, really good at is knowing what's at what particular level, because you're always counting by what's the spinal level. So that's what's at T8, liver. Then the next one is T10, so that's where the esophagus goes through your diaphragm.
T9.
T9.
T9, the level of the liver. BAcC point is T9. It's not here. Sorry.
Is it? Yeah,
Which is below that anyway.
but it's still on that.
Still in the cell.
Yeah.
It's below that.
T10 is the level of where the esophagus goes through the diaphragm. So it's not shown on here. So that's spleen. We're going to agree with spleen. And then the next one at L2 is the liver. Kidney. The kidney. Yeah. So what you've got is somebody has, in my world, mapped out. These are the major levels where things are on the back.
The diaphragm is
What?
at T7, you said it was at T10. So that's really confusing.
Okay, so the diaphragm starts here and it curves around. So you've got different points. So as you go back, if you imagine this is the back, the diaphragm's like that. So you've got the livers coming through right at the top of it, and then the esophagus comes through a bit further down, and then the aorta comes through at T12. Does that make sense? Yeah. So,
So, sorry, are you saying the kidney there, the back to the kidney, is where you've got the blood supply across to the kidneys?
Yeah.
Underneath there?
Yeah.
So we're talking about blood supply, not nerves?
Yeah. Well, thing is, I mean, in Han Dynasty, they just didn't know what nerves were, you know. And a brain, you know, it makes real sense that they say it's the sea of marrow, because it is. It's marrow. It's fatty. Yeah. It has the same quality. Yeah. So what you're understanding is not just what's actually there, but also you're making inferences from the quality of what you feel, and you're making correlations between, well, if I open up a bone, then it has this kind of feel, and when I look at a brain, when I feel a brain, it feels kind of similar. So maybe it's the same stuff, you know? But it's definitely not chewy. It's definitely not chewy. I'm going to regret that. I can feel that that's going to come back for a long time. Yeah. Anyway, all right. So the next one. Entry-exit points. Let's do this on a different. What did you find in your discussions about entry-exit points?
I think one thing is that a lot of us along don't use them or not really use them predominantly privately. Curious to know your thoughts. Yeah.
Ooh, Deborah? Charlie? Okay, good. Yeah. 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 Yes. Go on.
He was saying that it's a pulsing, so you take a pulse and you can preparing that there is a connected control is not found between the system when it uses entry and exit points to establish that organisation. And then apart from the tool as an information, you would also pick up on messages, symptom manifestations.
What kind?
So, for example, LI20 and stomach 1 with symptoms around the sinuses.
Okay. Which would be presumably a symptom of blockage?
Second,
Symptom of blockage? Or
sinusitis.
yeah.
Like you said, the dynamic, the flow of energy is not, it's blocked, it's not flowing.
Yeah.
That river's not going as it should up.
Yeah. Yeah. Okay. Anybody got any more? Any more?
Is it something to do with the idea of just a continuous circulation?
Yeah.
It seems to come from that point of view, which you don't have
Yeah.
Channel clearance as well.
Channel clearance. Can you say a bit more about that?
So the channel seems to be kind of emotionally stressed. It's again still part of the thing.
Yeah. Can you say what you mean by if a channel is in distress?
So if you do your diagnostic process, if it seems like that channel is causing problems, so then which channel is what it's responsible for.
So by the symptoms.
Yeah, so you're picking on that channel.
And so what are you doing with the points to?
So you effectively would needle the kind of beginning and the end of the channel.
Yeah. And what would you expect to happen?
To resolve the problem.
Okay.
And somebody who's about to retire, the capitalised advice says it's like 99% actually resolves the issue.
Okay.
Excuse me, the non-microphone, because I'm not really hearing what people are saying.
Yeah, there is a.
Repeat that thing about retiring. You said something about retiring.
Oh no, it's like somebody who's retired. So this information is given by Worsley. Oh, he retired.
You don't mind me passing it to you.
Okay. So
Yeah, I think she has.
sorry. Do you want to just say it again so that?
Just clinically, somebody who's retiring, who's used that method most of his life, it works apparently 99% of the time.
Okay. Thank you. Okay. So the picture on your left is an angiogram. So the way that this picture is arrived at is that you inject radiopaque dye into in this case, this is arteries that you're looking at. And then you take an X-ray. And so you can see blood flow on an X-ray. Okay? And so your entry-exit points are all going to be at the tips of fingers when they're on the hands or the feet. So they're going to be on the tips of fingers or on the tips of your toes. And then on the face, they are around the mouth and up on the forehead. So what you're looking at is the place where the blood vessels end. So this idea of circulation that came in the Su Wen is like, you're choosing the points that are where the blood vessels end. Is also where the meridians end. Yes?
But there's also things like lung 1, spleen 21, entry exit, aren't they? Is that right?
Okay, it's a flawed theory in that case. Okay. I've got no answer. Sorry.
At these points to see whether there's any end of flow or something at these particular points. Spleen, lung 1, spleen 21, number 14, heart 1.
That would be something that I can look at.
Thank you. Yeah, good.
Yeah.
Look forward to next time.
Yeah. 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 I think I've been focused on what happens like right at the peripheries, but yes, you're right. Yeah. Yeah. Okay. I'm anticipating quite a lot of comments on this one. Does everybody use this? Pretty much? Yeah. Okay, go.
The anatomical correspondence pair is the
homologous.
They are indeed homologous points. Yep. More. Yeah.
I tend to see it as where we hold tension.
Yeah.
We hold tension in our hands and feet, and that's how they work. That's my explanation to patients.
So what happens to the tension?
So tension the muscles, and so by needling it, you relax.
Okay.
Your hands and your feet, and therefore relax the body. If we go into this,
Is that also true of liver 3?
I haven't seen the study I saw a long time ago was only on slides before.
Okay.
Maybe it's likely that liver 3 is the same.
Yeah. Ah. That makes much more sense.
The ideal thing, feng shui location. The ideal location for a house is in a hollow, protected behind by hills, open to the front.
Cool. And what does it feel like? Who's had these points? Who's experienced this treatment? Yeah. Painful, weird. Can you say a bit more about weird? Is that spelt right?
Also, that was LI4,
Yeah.
That's been used at least once on the MRI brain depression sort of stuff that
Yeah.
Hugh McPherson's. Yeah, it was on the TV, so that was that study, and it's been repeated a few times. So needling.
So what did they find?
So what they found is when they did fake needling, it stimulated the limbic system in the brain, which relates to the perception of pain. And when they needled it properly, it initially stimulated, but then suppressed that area of the brain.
So it downregulated.
Yeah.
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 Of the limbic system, yeah?
Yeah. I think that's right. Perception of pain, apparently. LI4.
LI4.
Also, they're really easy points to explain to patients. You know, like if you've got a hobby, you can tell them
Yeah. Yeah, and sometimes I use that as an example of acupuncture. They say, well, why are acupuncture where they are? And so I say sometimes it's got a neurological aspect. Feel it there, you can feel it's a bit weird. Yeah.
Yeah. Okay. Go on then. Oh, pass the mic, pass the mic. Pass the mic. It's okay.
It's metal and wood, isn't it? So like the energy of the depth of the pen, it regulates wood on the paper, and the energy of that is
And I'm going. Okay. All right. So this is the point where we get some pictures of actual dissections. Everybody okay? Yeah? Yeah? Good. Okay. Okay. So you've already picked up on these are homologous points. Yeah? So they're in between the first and second digits on hand and foot. So I'm going to look at the foot one first. So this is actually the same dissection. This is the same foot. It's just that this one I handed to a friend of mine that's an artist and said, could you make it slightly less gory? Could you make it a bit more kind of pleasing to the eye? So he did this. So this is kidney 1. So and the blood vessels in your foot are they're really deep. They're underneath like 4 or 5 layers of other stuff, sort of fascia and muscles, and on this particular dissection, I took away the nerves as well because I was just interested in being able to show what the blood system does. So this is the part of the blood that comes down behind your medial malleolus, and then it goes underneath your instep, and so it's coming in here, and then kidney 1 is this point here, which is opposite liver 3. So if you wanted to, you could take your foot and you could scrunch up the toes, and you can test that for yourself. But liver 3 and kidney 1 are opposite each other, and that's because they are on the same blood vessel. So you've got the blood vessels coming through here, and then here it comes through. So can you see there's your blood vessel? So this is dorsalis pedis. This is the blood vessel that runs over the top of your foot, top of your instep. And it comes in between the 2 toes. I've taken all the muscles away, so you can see you've got one branch that's going off that's going to go and feed the big toe. And then the rest of it is diving down through that hole to join up here. Yeah? So you've got this point where the blood is circulating. It's literally making a loop. And you've got the same thing in the hand. So here we've got the same. So here's your radial artery. So your radial artery comes along on this side, and then it, if you take your thumb out, then there's a little tendon here, and it goes underneath, and then it comes around and it goes over this way. So that's what you're looking at here. So here it is. It's come under the tendon, and it's going through, and then it ducks down in between the 2 lumbricals, in between the two muscles, and then it comes out on the other side. So here you've got the thumb here, so it's coming through here. And in the hand, can you see this artery here? This is the ulnar artery. And what we did on this particular dissection is we took some colour and we injected it into the artery so that you could see really clearly. And so here's your radial artery, it's coming through, and you can see that all of this deep palmar arch here has got the dye in it as well. Yeah, so this is where that connection is being made, and your ulnar artery hasn't got it in. That's because your ulnar artery just comes straight down and goes through. And they do connect up, ulnar, or in an ideal world they do. They don't on everybody, but you can see there's like a little connection here. So in the end, everything would be full of the dye. But so you've got this place where the circulation forms a loop, and you've still got stuff that's going off to the ends of your fingers and toes. But at this point, which is very regulating. And so if you're an anatomist who hasn't been told what to think, and you're looking at this and you're going, what do I understand about how flow works? About how fluid flow works? Which points, where would I choose? This choice of these 2 points together, it's very deliberate, it's very specific. And when you look at the anatomy, it's specific. There's a really clear reason why you would go, I'm going to try these 2 together and see what happens. And I think just for just for a laugh, we put 365, so 365 points. We put it into Google and said, how many combinations can you get? We ran out of space. There's so many noughts, So, that thing of science, and you're using your observations, and then you're conducting empirical investigation. You're formulating theories based on what you've seen about what it does. And so here, and then you're testing in theory. Yeah? So all of the information that's come back from this room has been about what happens when you test your theory. It's your experiences of having that theory tested. But the reason for having the theory in the first place would be because you kind of look at that and you go, that's a really significant anatomical thing to have happen. Who knew? How many people in this room, can I just ask, how many people knew that your blood supply loops around in your foot? You did? Yeah, a couple of people. Yeah? Okay. Cool.
Can I just ask something?
Yeah.
How deep is that artery under the muscle that you?
So it's right on the surface and then it goes all the way through.
I'm just thinking of needling because sometimes you can get that bruising.
Yeah. I mean, you can see as well, you've got...
Angle according to the anatomy of that to make sure you...
Well, you've got lots of little arteries around the sides as well. And you're probably just catching a little one. It's kind of... I don't think there's a hard and fast way.
It's just a little capillary.
Yeah. Yeah. Yeah.
I'll just make a very general point.
Yeah.
Talk about observation and experimentation. Joseph Needham in Science and Civilization in China describes that incredible outpouring of Chinese science around this period.
Yeah.
As being rooted in Taoism.
Yeah.
Which was prioritized observation of nature.
Yeah.
And had no religious beliefs. It was purely the results of that observation.
Yeah. Yeah. And I'm personally, I'm convinced that this fits into that spirit of the time. Yeah.
Is this thing that you're describing, is that unique just to these 2 points in the body? Because I mean, they're both source points. Is that relevant?
It's the only place, so it's because they're at the periphery. Yeah. You have other places where you have, it's called an anastomosis, it's a joining. So there's anastomoses all over the body, and a lot of the points, I don't kind of want to go in, but there are a lot of points that are over places where blood vessels divide, or, this little loop is specific to here.
So similarly, you can make a similar argument basically most of the nerves travel alongside the muscular bundle. You can make a similar argument you're making about nerves.
Potentially.
Yeah.
Yeah. I mean, the point here is like, what were they looking at?
Yeah.
And nerves were a mystery. And like I say, with the flying points, they did go, it all travels together and then stuff happens. So we're going to mark where things happen. And they did mark where nerves were. But the idea of the nervous system comes later. So last one. Speed 6, I'm at 36. What'd you come up with? Didn't get that far. Should we just do it all together? Yeah, using them as a combination, as a point combination. So you use very common. What do you use it for? Nourishing? I can't.
Only by the spleen, below, for example.
No. Clear damp. That's spleen 6. Did I hear somebody say insomnia? Yeah. Can you talk a bit more about why you use it for insomnia?
It's earthing, it's getting back to the centre, so you stop the analysing the head by regulation. So usually combine it with like a
Okay. Any more? Anyone for any more? Okay. So if we just have a look at the anatomy of that. So if you feel on your own ankle, you can, well, I mean, you're all familiar with finding spleen 6, and there's a really big dip. And so what you have around your leg and your calf is you have this thick fascial sheath that works like a stocking, like a compression bandage. And it's quite thick. And spleen 6 is at the point where it sort of starts to thin out. So you can see here, this is where spleen 6 is. So you've got muscles that are either side of it and the bone, so tibia's here. And so it's a point where you can access it. You can directly access the blood supply. So the blood supply comes over the pelvis, comes down the inside of the thigh to the back of the knee, and then it splits. So here you've got blood supply coming down, comes down the back of the knee, and it splits. So you've got this main artery that's running down that then kind of curves round the inside of the tibia. So that's this one. And this is the first place where you can really get to it. You can see here you've got this big bulk of muscle. You can't access it. And then the one that comes around the back of the knee, it comes in between the fibula and the tibia, and it comes through the interosseous, through the membrane, and it appears where stomach 36 is. So what you're doing is you'll find these are the 2 points on the leg where you can access the blood supply. So again, it's like, if what you're doing is you are rationalizing of all the places in the body where I could put a needle, or of all the places in the body where if I was creating an irrigation system, where would I want my points of control to be? Picking those.
Challenging question.
Yes, please do. I love them.
To what extent are you cherry picking the points that fit your theory?
So
How does it relate to the other
okay.
points you've not mentioned?
So very obviously, I have picked out what I think are quite clear examples. Again, when I was looking at the Suen, there's a real limit of the amount of points that are actually in there. And then, you've got this sort of what to me is a revisiting of dissection and looking at the body that results in the Ling Shu, which is much more detailed and stuff. So not all points are going to fit this. And I'm, so I think it was like with the entry-exit points, not all of them are at the periphery. Not all of them fit that model. But again, you've got a thing of like, once you as an anatomist have shared your information, then people take it away and they make what they will of it. And even if something seems really clear because you're looking at it, by the time you've explained something and somebody else has reinterpreted it according to their life experience or their understanding of the body, then you get this huge sort of proliferation, and there is no evidence that I've been able to find that there's been consistent looking at the body. It's like there is evidence to say that people keep coming back to it. So in the Song dynasty, they came back to it. In the Ming dynasty, they came back to it. These are very well recorded instances of doing anatomy. But the point of looking at the point that I'm trying to make here is of the science, and that there is a rationale between, at least for some point combinations, where if you look at the body, you go, okay, that makes sense.
So your general thesis
Yeah.
is that acupuncture was primarily a way of controlling blood.
My general thesis is that acupuncture was a result of making a map of the body and then thinking of ways in which you can use needles and bloodletting and moxa to influence it.
It seems in a way that there's a happy coincidence that you then went from, so that they mapped out the waterways of the body, and then exponentially later on, it turned out that you could test theories, you could test Chinese medicine theories of how the body worked by applying bloodletting or needles to different points. But it then later turned out that there was the maps that they got from the blood vessels then mapped onto a wider system that worked through chi or through nerves or through whatever other.
I kind of don't remember saying that.
Or do you feel that Chinese medicine works because it controls the blood?
I don't have a theory for the mechanism of Chinese medicine. What I'm trying to look at is what medical science in the Han era would have looked like, and how you would understand the body, what you can understand from purely looking at what you can see, and then ways in which you would explore that what you see.
That's not medical practice, and mostly why we use acupuncture is through hundreds and thousands of years of clinical experience to find that sticking pins in people, bloodletting works to heal.
Yeah.
So it's a happy coincidence that mapping the body's blood system back in the hand later then turned out to be a useful map for basically another theory, really.
So I think, the purpose of doing the mapping was in order to find out where the blood vessels went, so that this would help with understanding disease. That's what the record says, and I don't, I'm then looking at the record and I'm going, okay, if that's why they did it, because with anatomy, you're looking at, the first three of these. Anatomy is observation, identification, and description. You don't learn about physiology from looking at a cadaver. You learn about physiology from formulating a theory about what you see, and then making an intervention, having an experiment of some sort. So if you're then going, okay, I'm going to experiment with bloodletting and with needles, and I'm going to use the bloodletting in order to drain blood away, and I'm going to use the needles in order to control it and regulate it, what happens? Sorry, Charlie.
Yeah, thank you for this. Very, very interesting. Obviously, as a scholar, you have to connect your investigations to the historical literature. And so here, you're starting more clay manuscripts.
Yeah.
But actually, I wonder what you think about backdating further to the Warring States period, where we had 250 years or so of continuous warfare, or continual warfare between war states. And these states had armies of 50, 100, 150,000 people chopping each other up on a regular basis. And of course, you had a class of traumatologists, called Yang at the time, who were specialists in trying to save people, who were draining costs, which is where the word "siet" comes from. Some of the earlier chapters, some of the older chapters from Su Wen actually was crossed out. They crossed out a non-cost, and they replaced it with the word "siet." So, and they talk about draining siet shi, but actually the earlier texts from the Warring States period were really talking about draining costs. So there's an element of the tradition that actually predates the accessible literature. And actually, if you are a person in a battlefield and somebody's had a sword injury to an arm, you can see the difference between what happens between an interference to blood flow versus what happens to an interference to nerves. Because obviously, if you transect a brachial nerve or what have you, the patient is then going to completely lose, the soldier is going to completely lose function. So I'm thinking that actually that's chi, that's invisible movement as opposed to circulation, as opposed to visible blood circulation. And so I wonder whether you might include the possibility of the idea of nerves actually being there. That's not very big, it's not quite visible anatomically. The brachial plexus is not invisible.
So they did map them.
But I wonder whether we should actually, besides the blood circulation investigation, whether we should credit them with actually having identified some other circulation that was more ineffable, that was more cumulative, that was actually what happened when you transect those people. This was 250 years of massive amounts of carnage with bits of metal between the states. Just a thought.
Giving you the next job.
Yeah. I mean, so everything that I have done, I've tried to relate directly to texts that we can get. So I try very hard to avoid speculation. Yeah. Yeah, please. Go for it.
So this is going back to what you were saying when we were talking about BAcC points.
Yes.
Parasympathetic nerve. Did I hear you right in saying that the parasympathetic nerve is the only one that supplies the organs directly? Is that what you said?
Yeah, so it comes down the centre.
Yeah.
The vagus nerve comes down the centre.
So if that's true,
Yeah.
if when we're doing acupuncture, if we use ear parasympathetic nerve point at the start of our treatment and then we treat our treatment plan, given that you're then stimulating the organs through the vagus system prior to doing anything, is it like you're kind of waking them up, or would that improve, as speculating, would it improve your patient's body's reception of the acupuncture and perhaps make it more effective or anything like that, do you think? Because you're already tapping into their system on a different level.
So to me, that seems logical.
It's logical, isn't it?
It's logical. The only way you're actually going to find an answer is to try.
I knew you were going to say that.
The only way you're going to persuade anybody else is to try on thousands of people.
Oh, yeah.
And
Do a
and
study.
then have conferences on it and stuff.
Thanks.
You got another one? Go for it. I thought you said you had another one. Oh, right, okay. Yes.
Just following what Charlie was saying about the nerves.
Yeah.
I mean, you've got some empirical sensation of nerve feelings. Everyone
Yeah.
would have these electrical feelings, and if you take the she's talked about a lot,
Yeah.
at least part of that, a good chunk of it, is related to some kind of nervous stimulation, isn't it?
Yeah.
It has to be. So in that sense, and then using these points, you feel it going down predictable pathways in the hand. So even though you might not get it from dissection, but to me they would have had some knowledge of that electrical tingling, whatever it might be. They might be useful.
I mean, it's that thing of like, you know there's something else.
Something there.
Yeah.
They knew that was there above and beyond blood.
Above and well, I mean, that thing of like, you open a body and the blood's all still there, but they're dead. There is definitely got to be an additional animatory thing, but how you establish that from a cadaver, you can't. Yeah. So it was there. I'm sort of aware as well that it's lunchtime and people might want to go. So one more question.
Well, I may be opening up another can of worms, really, and I came late. So I wondered what your thoughts about fascia are, and the difference of fascia, in a living person to a cadaver, whatever you call it.
Yeah.
So I'm just intrigued that that movement within the body. How does that affect everything else, really?
So your
Briefly.
neurovascular bundles, they sit in fascial sheaths, by and large. So that's part of how the bundling happens. So you've got fascia traveling with it as well. When you make dissections, by and large, you pull the fascia out of the way because what you want to look at is the thing. I mean, for me, when people talk about the Sanjiao, I just see 3 different compartments that are separated by big fascial sheaths. But I'm going to argue that on a different day.
That would be really,
Yeah?
because people have been arguing about Sanjaris for as long as this recorded
It's really weird, you see. Yeah. Yeah. I mean, yeah. Anyway, it's lunchtime. Thank you very much for your attention and for engaging.